Spotlight on Berkeley Heights is provided by funding from DeFabio Chiropractic, where integrity, thoroughness, and a friendly staff have been servicing the community since 1985. DeFabio Chiropractic is where an accurate diagnosis leads to rapid pain relief and better function. Located on Springfield Avenue in Berkeley Heights, it's the natural choice for your healthcare needs.
Hi, I'm Dr. Donald DeFabio, and welcome to Spotlight on Berkeley Heights, the pulse of the community. Well, a lot's happening at Summit Medical Group. It's the Live Well Festival. It's really exciting. There's a lot of activities going on. Gyroscope, archery, some world-class fencing and rowers are here. But what's really important is Dr. Jeffrey Rosenberg is going to talk to us about concussion management. He's going to give that presentation today, but we were able to grab him before his presentation so you can hear all about concussion management. A lot of kids, it's great. I'm Dr. Donald DeFabio. Let's go hear from Dr. Rosenberg. Dr. Rosenberg, thanks for coming down today. I know we pulled you away from the Living Well Festival here at Summit Medical Group, but it's pretty exciting, isn't it?
Yeah, it's really great. It's really fun. I'm going to be giving a lecture in a little bit, so I got a little time to talk before I head up.
Yeah, well, I appreciate it. And your lecture is just what we want to talk to you about.
Okay.
For the people that can't make it.
Okay, great.
Concussions.
Yes.
Getting a lot of press today.
Yes.
It's estimated that there's going to be about 300,000 concussions in the adolescent population. Is that
Probably,
correct?
yeah. I mean, probably
Annually?
even a little bit higher.
A little bit higher than that.
Yeah.
You know, didn't used to be that way.
Well,
Is it more concussions are happening, or what's the deal?
Right. I think that in general, the amount of concussions may be a little bit higher, but just with all of the press concussions have been getting, that there's just a lot more press about it. The kids are not ignoring it. The parents are not ignoring it. The coaches are finally not ignoring it. And so because of that, people have realized that these things are important. Coming basically down from the NFL all the way down to the smaller leagues of play now, all coaches are required to have concussion training as part of their ability to be a coach. The umpires and the referees are also all taught as well. And if a referee actually believes a kid had a concussion, even if a coach or an athletic trainer doesn't say so, by law now they have to sit out the rest of the game. Mm-hmm. So because of that, there's just a lot more attention being paid to concussions, which is great because although most concussions, or most people think most concussions are pretty benign, there's obviously a lot of risks and a lot of consequences of having concussions, both over the short and the long term.
So two things. I want to talk about what a concussion is, but a term I've heard, and I want you to clarify this, is traumatic brain injury and concussion are pretty much synonymous.
Yeah, they are for the lay press. Yes, absolutely.
I mean, do people have to understand that concussion is an injury to the brain?
Right. A concussion is one kind of traumatic brain injury. When we look at traumatic brain injuries, we can break them up to concussions, which is kind of the most mild form, all the way up to fractures and to bleeds into the brain. About 75% of traumatic brain injuries are concussions, or the much more milder version. More of the other ones are typically the kind of injuries you get with bad car accidents, major traumas, and falls, where there's really been an injury to the brain more anatomically. For a concussion, there's nothing wrong with the brain when you look at a picture of it. So that's really the main difference with it.
So it's a mild
it's a mild form of a traumatic brain injury.
All right, well, I want people to kind of grasp that it is a significant finding there.
Yes, absolutely.
So what would be a typical scenario, let's say in the adolescent population? What kind of symptoms would the player or the coach or parents see?
Right. Well, at the time of the injury, and we could talk a little bit later about what kind of injuries cause concussions or who gets concussions. Typically at the time of the injury, either, and it's always more traumatic when it does happen where the player can actually lose consciousness or get knocked out. Luckily that doesn't happen very often, but when it does, that's pretty traumatic. Otherwise, what we usually see is a player who gets up and they just don't look right when they even get up off the field. They look a little dizzy, they may be walking to the wrong side of the field or into the wrong huddle. If they do attempt to ignore it and try to play another play, they certainly don't play well, and they kind of look like they're very behind and struggling to kind of keep up with what's going on in the field.
So that's kind of a no-brainer. That's a pretty easy one to pick up.
Yeah, that's the ones that everyone's kind of very simple about. You know, it's very easy to know they're there, and somebody kind of can go out and help them off the field and then get them evaluated at that time. When somebody actually passes out or gets knocked out from a concussion, that's somebody who we have to be really careful with. We always have to assume that there's been a neck injury, and so they have to be kind of officially bordered and colored in a way that protect their neck. Even when they wake up, it's still important to kind of do that to protect their neck, get them seen in the emergency room right away to make sure that there's no spine injury, and then deal with the concussion kind of secondarily. If there's a hit that's bad enough that the patient's unconscious and not breathing, obviously the breathing issues start first, and that hopefully will be dealt with by professionals who know what they're doing at the sideline at the time. Most schools have practiced that with the local EMS squads and the physicians and such, so everybody kind of knows what their position is when those things happen.
What about someone who got a concussion but isn't visually impaired?
Right.
What kind of symptoms would they be mentioning to their coach or their parents?
Right. Well, those kind of, in some ways, are like the old ding they used to call it. They used to say, I got my bell rung, or I got a ding. And what that means is you got a hit, you felt okay, but within a few minutes or maybe within a few hours after the game, you start to develop more subtle symptoms, headaches, feeling dizzy or nauseous, feeling really tired and sleepy. And along with that are a variety of other, basically confusion signals in the brain. So, just can't follow directions, can't remember things that either happened before the injury or afterwards. Can't remember, what they had for dinner, even though they just went to bed or just finished.
I can't remember what I had for lunch today.
Yeah, well, that's always one of the questions we ask them, is if they remember when they get hit on the field, is, who are you playing, what's the score, and what did you have for breakfast? So I think most of the kids are taught to remember to have their bagel every morning, so they just say bagel. So, so those are the folks who, are a little bit subtler because they kind of got through the game, maybe they didn't tell anybody about it, but their parents just noticed they don't look right later on in the day.
Glazed eyes?
Glazed eyes, yeah, that's certainly one thing we'll see. Again, on the field, when they first get hit, we'll really notice their eyes are kind of not focusing or are kind of glazed over and not able to follow commands. The more subtle ones that you pick up later on at home are the kids that their vision's okay, they just starts to notice things are a little blurry at home. Or the other thing they do is get really aggravated by loud sounds and bright lights. So maybe they're doing okay, but they go home to watch TV, or their brother puts some music on and they start screaming at their brother for no reason because they just don't feel very well.
Okay. Now, would those types of symptoms escalate?
Hopefully not. Typically, again, if you had symptoms that develop after a game, they can even start really the next day, and I've certainly seen plenty of people who felt okay that day, although they did have a bad hit, they felt okay, but the next day really started to feel much worse. If symptoms are escalating, if people are becoming more and more confused, if they're really making less and less sense, that's something that means there may be something that's not just a concussion going on, and that may be somebody who should actually go to the emergency room. Many people do take their children to emergency rooms after they've had concussions. If it's a simple and mild concussion, usually in the emergency room, although they get CAT scans, they really don't need them done. And they basically say, you've had a concussion, you can go back home now. So if your son or daughter has a concussion and they kind of feel the same, they don't escalate in the way they feel. If there's no major change in their cognition or their memory or the way they feel, they can probably be safely managed at home. Give them some Tylenol or Motrin, make sure they try to eat even though they don't want to. Let them sleep as much as they want, and let them follow up with the doctor within a few days to kind of be able to monitor your child.
Now, sleep is a good thing. What about
sleep is a very good thing.
You got a concussion, we got to keep you up for 3 hours.
Yeah, no, that's been proven not to be necessary to be done. All that does is make a more tired child and a more tired parent. More tired parent. So yeah, basically you can look in on them, make sure they're breathing. If they looks like they're jerking or having any convulsive movements while they're sleeping or having unusual breathing patterns, those are all things that would make you kind of go and make sure Johnny's okay and maybe take him in if he wasn't in already. But that idea of having to be woken up every few hours is just that's old school at this point.
Great, excellent. That's important to know. So we mentioned two things, but we're not going to talk about them right now. We're going to take a short break.
Okay.
But we talked about how concussions occur, who's most at risk. Because let's face it, I think people understand we've been hinting about one sport here, football, but I know they occur in other sports and other activities. So we're going to talk about that, but also, I don't know if people heard you mention get evaluated. There is a difference in who evaluates for a concussion. There are appropriate people to see. It's not just going to the doc. Right. So those are the two things we're going to talk about. But we're going to take a short break. I'm Dr. Donald DeFabio. This is Dr. Jeffrey Rosenberg. And when we come back, let's talk about how concussions occur.
Great.
We'll be right back.
A new crop of players has been voted into the Pro Football Hall of Fame. And while you might assume his 13 trips to the Pro Bowl, 38 career records, and 3 Super Bowl rings are what made San Francisco 49ers star receiver Jerry Rice a shoo-in for the Hall, he says you can also credit his chiropractor.
My first experience with chiropractic care was right before the 49ers were to play the Bengals in Super Bowl 23. A couple of our players were injured, and a chiropractor turned things around.
Rice, who says a chiropractor helped him weather countless bone-crushing hits, also spent time with the Raiders, Seahawks, and Broncos. Today, he's a spokesperson for the Foundation for Chiropractic Progress, a not-for-profit organization dedicated to increasing public awareness of chiropractic care. He even credits such care for helping him succeed in what some have humorously called his second career, performing on Dancing with the Stars. For more information, visit yes2chiropractic.org.
Welcome back to the show. Dr. Rosenberg, concussions are prevalent anytime you can get an injury to your head.
Correct.
It's not just football, correct?
Right, it's not. I mean, football gets all the press, and with everything that's going on in the NFL now, that's one of the reasons why we're all paying more attention to concussions, but concussions can happen really at any age. In young kids, before they really start with heavy sports, the playground and bicycle accidents are the 2 most common reasons why kids get concussions, and that's why your son or daughter should wear a bicycle helmet when they're riding, or even if they're rollerblading or skateboarding, because that's the group that gets most injured when they're young.
Really?
In the more middle and high school age children, obviously for boys it's football, but also lacrosse and soccer, and then for girls it's mostly soccer as well as bicycle injuries and actually volleyball and basketball. And I think both of those are because there's a floor to hit with your head. So basketball players, you often are pushed over or knocked over, and then when their head hits the floor, that's what gives them that concussion.
That's when it gets it, yeah. It's interesting you mentioned volleyball. My daughter got a concussion in volleyball, but she wasn't in the play.
Yes.
The ball ricocheted and hit her on the side of the head, and she ended up getting concussion. She lost 2 weeks from school.
Yeah. So the traditional concussion injury that people think about is a blow to the head, where somebody, 2 players or 2 people going together, their brains, their skulls get together, and basically the brain inside, flops back and forth inside of the brain, inside of the skull, and that's what releases the chemicals from deep inside the brain that cause the concussion symptoms. Non-contact injuries are usually more of a twisting injury. So just like your daughter had, if you kind of twist your brain on the brain stem, so a quick change in direction. If you're running, you get hit from the side and your head goes that way, or again, a twisting injury are the other most common reasons why concussions occur.
How does that occur? Let's talk about that twisting mechanism, because I think people can grasp a direct blow,
right.
But a rotational blow, the brain sloshes around on the head, or?
Yeah, I mean, it's not actually the trauma of the brain against the skull that really causes concussion symptoms. It's the twisting of the brain in the brain stem, which is deep inside. So the top of your spine, kind of above the big major part of the brain, is the brain stem, and it's movement within the brain stem that seems to cause most of the concussion symptoms. And so that's why it can happen with both twisting injuries as well as the back and forth from impact.
So it's not just mechanical, it's also chemical.
Yes. So what happens at the time of the concussion is that the nerve tissue releases chemicals, and those chemicals do 2 things. One of them will increase the metabolism of the brain, so the brain actually wants to have more blood flow into it to get it obviously healed. The second thing is those chemicals cause your blood vessels into the brain to get smaller, and so your brain's asking for more blood, your body's not giving it the blood it needs, and that's why you have concussion symptoms. Once the brain starts to control the blood flow into the brain, once the blood flow into the brain gets controlled better, that's when your concussion symptoms typically go away.
So is that where management of concussion comes in?
Yeah, I mean, for a concussion, the management really is to do a lot of nothing, and that's for most people, that's enough. Most people do get better within 5 to 7 days. Most typical high school concussion symptoms are better or almost completely better. But what you need to do is let the brain rest, because the brain can't heal itself if it's busy doing other things. If you're trying to watch TV, if you're trying to go to class and pay attention and learn, your brain's not going to do that very well. And also because your brain's trying to do that, even though it's doing it poorly, it's not allowing itself to kind of heal from the injury. And that's why really just sitting, basically I tell kids to go home and either watch their fish run around the fish tank or watch the grass grow. And it's pretty torturous for most kids, because our kids nowadays are
no more iPhone,
no more iPhones, no
Wii,
computers, no video games, all that stuff really can really bother you. And most of the kids don't really want to agree with me, but when they see me the next week, they said, yeah, I started to feel better. I went to do something. I went on the computer for an hour, or I tried to even read a book for school, and I just had to go back to bed. So they can tell, even though they're almost ready, their brain's really still not 100%.
So resting the brain is really important. Just like if you sprained your ankle, you'd have to stay off the ankle.
Right, exactly. Resting the brain is the mainstay of treatment. And what that does mean for kids that are in school is that often now we will actually keep the children out of school for a while. That while may be 2 days, it may be 4, it may be a few weeks, depending on how well the child's recuperating. After about 5 days of being away, the schools are required to provide a tutor for your child once they're able to get back into the swing of things. When you do get back to school, a lot of times we'll do it very slowly, maybe only half a day for a few days, or be allowed to go to the nurse's station, take a nap in the middle of the day. Also going in.
I vote for that.
Yeah, absolutely. Instead of going and eating at the cafeteria with all the other children where it's really loud, we have them go and eat in the nurse's station or in a really quiet place just to allow them to kind of calm down and get ready for the afternoon.
Interesting.
All that noise. But being in school is a pretty loud and bright place when your brain's not working well.
Sensory overload, and just the brain can't handle it.
Yeah, absolutely.
So, doctor, when the kids are ready to go back to sport, is it the same as, with academics? You're just off, and then all of a sudden you send them back, or is there a protocol involved?
No, there's usually protocols, and actually now in New Jersey these are all state mandated, but you have to be cleared by the physician, and you should have, as part of that process, you're typically given what's called an impact test. Impact is a computer-based neuropsychology test that basically measures your brain's memory, concentration, and some reaction time. And this is a way for us to really tell whether their brain truly is better. Unfortunately, we've seen over the years many people, especially football players, or more boys than girls, but they want to play so bad, they just tell you that they feel fine, even though you can tell they really don't. And since this is something we can't see, it's not like an x-ray that we can take to make sure the bone's better, or you can see the skin's healed up. We can't tell if you're really better with a concussion. So the impact test is a way for us to measure your brain's function, and we want to see that you're kind of back to where you're supposed to be. Nowadays, a lot of schools are testing all kids every other year at baseline so that we have something to compare them to in case they get an injury later on down the road.
About that impact test,
Yes.
though, you mentioned every other year. Is there a relationship with maturing, just normal maturing, and having those scores change over time?
Yes, absolutely. I mean, there's a little bit of learning curve in taking the test, but in general, if you go from 9th grade to 11th grade, you've learned a lot in there, and your brain and your concentration and focus your brain function should have improved all along.
Okay.
And so if we're using looking at a 12th grader and trying to compare their brain to what they were when they were in 9th grade, they're not really going to be back to what's normal for that child. So if we have the recommendations now are every other year, so you have a better baseline. Once we know that their brain function is kind of also back to normal, then we say this child's now safe to go back to a place where they could potentially hurt themselves. The next step of return to play is a process where over a 3 to 5 day period, so you slowly increase the amount of exercise you do, both the intensity and the duration of it. And as long as your headache symptoms or your concussion symptoms don't come back, then you're truly safe to play at that point.
Great.
If at any point along the way you start exercising and you start to feel bad again, headache, memory issues, nausea, whatever your symptoms may be, then really that means you're not quite ready. Even though your scores were okay, you're really not quite ready yet, because stressing out the brain, again, puts it at risk for having those concussion symptoms again.
Higher risk groups? Are there higher risk groups for concussions?
The highest risk group is obviously a child who's already had a major concussion, so we do know that once you've had one, you're more likely to get another one with a less intense impact, so less force. Can give you just as much symptoms. The symptoms typically last longer the second or third time. And we know there are certain things that do typically cause us to know there's going to be more of an issue. Learning problems such as ADD or dyslexia, history of migraines to start with is a really big risk factor. If you have any significant mental health history, so if there's some depression or anxiety or school phobia to start with, that's a kid who's really hard sometimes to get back to school because they don't want to really be there to start with. Yeah. So those are the groups that typically we have the hardest time with in getting them back to play.
Wow, a lot of information.
It's a lot of information, yeah. There's a lot going on in concussions.
And what I find interesting is, you're a sports medicine doctor and you have a wealth of information about concussion. We're going to take another short break, and I want to make sure our viewers grasp the fact that there are people who specialize in treating of concussions,
Sure.
and it's not necessarily a general practice. Dr. Jeffrey Rosenberg's my guest, and we're going to talk about concussion treatment in a moment.
Humans may have been sitting since the caveman days, but apparently we're now overdoing something that's giving many of us chronic lower back pain. What? Driving. According to experts, millions of Americans experience the most common form of back pain, muscle tension, the result of drivers remaining in a static position while maintaining a heightened sense of awareness. The Foundation for Chiropractic Progress explains that driving requires constant alertness and tension, which can itself create the scenario for muscular pain. Extended periods of sitting can cause added pressure to the lumbar spine and compress surrounding soft tissue. Doctors of chiropractic are trained to improve structural positioning and can offer preventive expert advice. First, sit closer to the pedals, avoiding full leg extension, and keep arms bent slightly in the 10 and 2 position on the wheel. Second, never place bulky items in your back pocket. Third, break up long journeys into no more than 2-hour segments. And finally, place a pillow in the small of your back to improve posture. Learn more at yes2chiropractic.com.
Are you or your child at risk because of the weight of your handbag or backpack? Could be, says Dr. David D. Oliveira of the not-for-profit Foundation for Chiropractic Progress. He explains.
Heavy bags can strain your back, arms, neck, and shoulders. That's why handbags should weigh only a pound or two, and backpacks no more than 10 to 15% a child's own weight.
If you do develop pain, a chiropractor should be consulted for evaluation and treatment. Learn more at yes2chiropractic.com.
Welcome back to the show. It's been a lot of good information. What do we have so far? Well, concussion can happen a lot of different ways.
Yes.
You don't have to be knocked out from getting a concussion.
Right, absolutely not.
They're very, very common, more so than originally we thought. And it's okay to get some sleep if you do get a concussion.
Yep, that's the main thing you need is a lot of rest.
A lot of rest. But what we haven't really hit on is getting to the right doc to diagnose it. Because I know if I've seen it, people come into the office and say, oh yeah, I got a concussion. I went to, the emergency room or the place and I went somewhere and they said, oh, you're okay, you can go back, and they're still having a headache.
Right, right.
And that's not a good thing. We need to talk about a second concussion syndrome, but
Right.
more importantly, how can our viewers know they're getting to the right person to evaluate their concussion
Yeah,
symptoms?
I mean, that's always a good question. And interestingly, a lot of neurologists are not most up to date on all of the newest concussion guidelines. So what you really do want is somebody who's at least experienced and knows what the newest kind of rules and recommendations are about concussion treatment. I'm a family physician by training. I then did an extra year of what's called sports medicine, which is where I first started treating concussions. Along the years have just been picking up more and more people who have concussions and going through the process of getting them back to play. Orthopedic surgeons, they kind of want to look at the bones and the joints. The concussion's definitely out of their league because it's only a brain issue. So it's important to find somebody who's experienced and who's been through a lot of training to deal with concussions, which I certainly have been.
Well, let's get to the quick then.
Right.
So if people have questions for you,
Yes.
how would they get in touch with you?
They can get in touch with me here through Summit Medical Group. All you have to do is call the main number at the practice and ask to make an appointment to see me, and the folks who pick up the phones know how to get people into my schedule.
Okay, yeah, because it really is important that you get to the right doc. 'Cause
Yeah, I think it's
I see it frequently, and that they're just not getting the right information.
Yeah.
Either going back to school or back to sports, or just mismanaged.
Yeah, most of the pediatricians are finally learning kind of the newest rules and protocols as well. So,
But there's a lot of layers.
Yeah, there's a
going
lot of
on
language,
here.
but what happens a lot, most times people start with their pediatrician, and then their pediatrician kind of sends them on to somebody who's a little more skilled at them if they don't have that comfort. They certainly can manage them if they're interested, but again, concussions seem to be very much a experience-based kind of problem where the more of them you've done, the more experienced and comfortable you are, and making sure everything's okay for the future.
Sure. So we clearly want to make sure you get an accurate diagnosis. We want to make sure that the return to play, return to school guidelines are followed.
Right.
However, What happens if someone goes back to sport too soon?
Right, and that's the biggest danger, and that's the reason why all these rules really exist, which is that if you were to get another concussion before your brain is really over the first one, and by being over it we mean your brain, you're academically back to normal, you're able to do sports without any symptoms. If you can do those two things, then your brain is safe. But if you're really still even mildly symptomatic, feel pretty good, get a little concussion, get a little headache, and then get another injury, you can actually cause a major problem. Those blood vessels that your brain wasn't controlling very well before, all of a sudden those blood vessels open wide, and you get a very fast increase in pressure into your brain. And basically within 5 minutes you can be in a coma and you can die from that.
Wow.
Luckily it doesn't happen very often. It only happens typically 10 to 15 times a year in the country. But when it does happen, it still happens, yeah. And you do not want to be, when that happens in your community, when that happens in your school, it's very tragic for everybody.
Sure.
And it's very difficult to deal with. So almost all the things we've talked about are really there to protect the students so that tragic second injury doesn't happen. That second impact syndrome typically only happens in young kids. So once you get to the college and the pro level, they don't typically have that problem with the second impact. If they're not 100% and they get another headache, get another concussion, they'll certainly feel lousy, but they're typically not at risk for dying.
Okay.
So that's one reason why in the pros in the past used to be able to kind of go back to play pretty quickly because we knew that the risk of them having a serious injury or coma is pretty low. What we have learned though is that there's a lot of long-term repercussions of having all these headaches. I mean, having all these concussions, and that's really the newest thing that's come down the pike recently. This diagnosis of called chronic traumatic encephalopathy is this finding that we're seeing in more and more of the retired football players. It's basically was discovered about 4 or 5 years ago now at this point. And what it is a constellation of symptoms in retired people who went through a lot of concussions, and they typically are depression, substance abuse, and then violent deaths. And so people are not only committing suicide, but actually killing family members and then killing themselves. And there's been a big rash of this over the past 5 years, and they've found some new pathological processes going on in the brains of these players, where even though they may be 50, their brain looks like the brain of an 80 or 90-year-old person with Alzheimer's. So there's actually repercussions of concussions over the long term at these very high levels of play as well. Sure. So they may not die in a coma right away like your high school student would, but they've got much bigger problems down the road as well.
So that's when concussion type symptoms may show up on an MRI or a CAT scan, but the first concussion where there's some dizziness, some headache, fatigue, lassitude, there is no test for that, correct?
There is no test, right? It is really it's a clinical test, and if you do find something on your CAT scan when you go to the emergency room, now you don't have a concussion, you have a bleed or you have a fracture, or you have some other actual anatomical injury, and those are managed partially the same in the sense that you need to let your brain recover, but you also have to let that specific injury that you're now been diagnosed with, that needs the appropriate treatment. Sometimes you can need surgeries for bleeds in the brain. Fractures just need time to heal. So although your brain may feel better in a week, your skull's not ready to go back to play for 6 or 8 weeks. So that's always going to be frustrating for people.
Sure, sure. Do you have any tips? Do you have a line that you give your high school athletes that come in that you need to let them know that you got to tell me the truth, what's going on here?
Yeah, I mean,
how do you address that to the high school athlete that wants to get back in the game, that you have that gut feeling he's cutting it a little too close or she's cutting a little too close? What do you tell them?
I basically tell them the truth, which is that, and I always tell this to them and the parents at the same time, which is that the risk of you going back out there when you're not ready, and if you're not ready, you get another injury, you're going to feel really lousy for a while, or you could die from it. And although college, even though high school sports is so important to many people, when you tell them there is that very small but potential very severe risk, they kind of get it that it's a little bit more important. And again, I think it's not just a ding, right? And I think nowadays it's getting easier for us to really recognize that it's easier for the athletes to realize there's repercussions. Every high school has got kids that are out on concussions and have missed school for a few weeks, and so everybody kind of knows somebody now who's been dealing with it. And I think that's again made it much easier for the students to report them. And that's one of the reasons why we're seeing so many more concussions in the medical field.
Dr. Roseberg, great information. We
Thank
really
you.
appreciate your time. You are our local concussion specialist.
Thanks very much.
I'm Dr. Donald DeFabio. Thanks for tuning in to Spotlight on Berkeley Heights. And we're going to let you go back to give your lecture.
Yes, I got to
on
go talk
concussions.
about it all again. Yeah.
There you go. But now it's immortalized forever.
Right.
And no, we really appreciate your time.
Oh, my
we're
pleasure.
going to go back and visit with the rest of the people at the Live Well Festival.
Great.
And thanks for tuning in. We'll see you on the next show.